We're going to show the rehabilitative exercises now for the hip joint. The hip joint is going to be in 3 different segments. Number 1, polishing of the hip joint to hydrolyze the joint, to reduce arthritis, and reduce scar tissue of the hip. Exercise number 1 is grabbing of the knee and again lightly polishing the hip joint. Exercise number 2 for stabilization of the hip joint is feet apart, grabbing of the buttock, and bridging up, squeezing the butt muscles of the hip joint. Stretches for the hip joint will be bending of both knees are bent, bringing this thigh across the body. Good idea to have the patient feel the hip joint as they stretch to help give them an indication where they're stretching and to give the best feel to the hip itself. A stretch needs to be held about 20 to 30 seconds to be effective and can be held much longer. This is the adduction or the lateral TFL stretch of the hip. Next is the figure 4 where you're working the adductors of the hip. A figure 4 position, a light stretching of the adductor muscles. Next to the stretch of the hip is grabbing behind the leg and bringing it up. Now, very important to understand, a very nice stretching, if you want to stretch high up into the hip, is to bend the knee and use a towel. Bend the knee, and bring the hip up like this. Stretches high up into the hip itself. If you want to stretch more down into the knee or quad, you do a straight knee stretch. Up into the hip, bent knee stretch. And then the front quad of the hip, drop the knee down off the edge in this manner. Or to stretch the front quadricep, all the patient has to do is turn on their side, dropping their knee back, and push their hip forward. Will also stretch the front quad of the hip. I'll have you sit up now, turn on your side, put your hand under your thigh, push. Feet together, sit up sideways. Very good. Now, we're going to use tubing. Often hip joints are damaged by compressive injuries, so the rehabilitation of the hip needs to be done with the decompression or traction. A very effective way of doing that is with the tubing placed to the back of the door, about 18 inches up. The tubing just has 2 little knots in the end. Make sure the knots are all the way through the back of the door. Shut the door. Place your foot through the tubing facing away. Then have a seat with the tubing wrapped around the back of the heel and over the toe box. High gym shoes work very nice with this, creating no discomfort whatsoever. In this position, you can adjust the amount of tension or traction by simply sliding your chair further or closer away from the door. In this position, the first thing that you want to do is sit, get a comfortable position, relax, adjust the tube tension, then create a polishing of the hip joint to hydrolyze the joint, remove scar tissue, and remove future arthritis. Polishing and circumduction should be very comfortable to the patient. Once you've done this till the patient feels good, then you can start rehabilitating with strengthening. You work adduction. You work abduction. You can work extension by just kicking the the heel to the floor, squeezing the buttock around the hip joint. And you can do slight flexion by just lifting the knee. If you have older patients who have a hard time with balance, it's a good idea to place the tubing in the back of the door, lower, about 6 inches up. Place the tube around their foot. Place their hands on both sides of like the corner of a room. And you can do 4-way hip. One starting off with extension. Now, as long as the foot never gets even with the other leg, it's still traction. As soon as this leg gets even with the other leg, it goes from traction to compression. So we don't want that. So keep it into pure traction. A heart rests 70% of the time because it hits and relaxes. That's the motion we want to use for rehabilitation. Hit, relax, hit, relax, hit, relax, hit, relax, hit, relax, hit, 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 hit. This is going to increase the circulation to the hip and be very comfortable. We then also want to do adductor. Hit, 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 hit. We can do flexion. Hit, 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 hit. Note, my foot never gets even with the other leg. It's all traction still. Adjusting the tension by just stepping further from the door. Abduction is the difficult one. Don't perform abduction sideways. It puts too much pressure on the hip. Face the tubing, kicking sideways. There is one more action that can be performed for a hip joint that feels very good. Sitting, adjust the traction. Bend the knee with an occasional kick. Kick. Kick can completely reduce compression and adhesions in the hip joint. And that concludes the rehabilitative exercises of the hip.